Guru Brahma, Guru Vishnu, Guru Devo Maheshwaraha. Guru Sakshat Parabrahma, Tasmai Sri Guruve Namaha. Evenings are the beautiful sweet spot between harsh light of the day and dead darkness of the night. So in this beautiful evening, I am S.T. Tilottama studying final BMS in Government Ayurveda Medical College, Nagarkoil. Welcome you all for this wonderful session organized by our IAS Voice Committee. Today, we are going to see a wonderful topic named Yoga for Kidney Disease by our Dr. M. Thiruchitrampalam, BNYS MD in Yoga, who's working as Assistant Professor in Department of Yoga in Sona Medical College of Naturopathy and Yoga, Salem. He has completed his UG in JSS Institute of Naturopathy Yogic Science and completed his MD in Yoga in Government Yoga Naturopathy Medical College and Hospital in Chennai. He has conducted various yoga naturopathy camps at government sectors like TNPSC, Tamil Nadu Health and Transport Corporation, Captain Srinivasa Murthy Regional Ayurveda Drug Development Institute, and other non-governmental organizations, corporate institutions, etc. He is the founder of Viveka Yoga Center, Sulu, also the founder of Sri Agasthyar Ayush Integrative Clinic, Sulu. Welcome, sir. Without much delay, let us hand over this session to him. Sir, over to you, sir.
Thank you, doctor. Thank you for brief introduction to me.
Sir, voice is little feeble.
Am I audible, madam?
Yes, sir.
Okay. Thank you once again for giving me such a great introduction. Okay. Am I audible right now? It's clear right now?
Yes, sir. Yes, sir.
Okay. I would like to express my sincere gratitude to all my parents and my teachers, lecturers, and my friends, those who have helped me a lot to bring me here. So once again, I would like to thanks this platform to having me today. Thank you all. Without occupying much time, we're going to start yoga for kidney disease. It's today my topic. Okay, let's start the session. Okay. Okay, in general, before going to detail about the disease, I'm going to give some basic knowledge about the kidney. Then we're going to explore the disease wise, then management wise. So, okay, let me give the brief introduction about the kidney. Kidney is bean shaped organ. So it mostly it present in the posterior aspect of the body. So it's called a retroperitoneal organ. So majorly we have two kidneys, left and right, vice versa, left and right. So on the location wise, it's approximately located on the lowermost thoracic dorsal spine on the 12th vertebrae to lumbar vertebrae, third position. Then the size of the kidney from left to right, it will be vary little bit. Uh, it is 11 centimeter long, 6 centimeter broad, and 3 centimeter thick. Then weight of the kidney, it will vary from the gender. For males, it will be 150 grams. For it is female, 85 gram. So these all are the basic about the kidney. And the next, okay. So we saw the basic anatomy of the kidney. So next we move into the functional aspect of the kidney. Functional aspect, without touching the physiology of the kidney, the functional aspect will not be fulfilled. So what are the functions will be carried out by the kidney? We're going to see in detail about the what are the different physiological aspect, what are the some metabolism will be carried out by kidney. So we're going to discuss now. First of all, the role in homeostasis. The homeostasis is in our systemic body there are different kind of metabolism, like the calcium metabolism. These all are the very few metabolic things will be regulated by the kidney. So without kidney, the calcium metabolism and all will not be regulated in proper manner. So role of homeostasis is such an important thing for kidney function. Next we move into the function is the blood production of blood cells. So main role of the kidney in the hemopoietic function means kidney help to secrete, kidney majorly secrete the erythropoietin, one of the major hormone which help to production of the red blood cell. So that's the way it will help in the hemopoietic function or erythropoiesis activity. Next we move on to the endocrine function. As I said previously about the hemopoietic function, similarly endocrine function, So there are other than erythropoietin like calcitrol, renin. These are the hormone will be secreted in the kidney. So each and every hormones will be uh, helped to uh, functioning the various metabolism in our body. Likewise, the calcium metabolism, uh, the calcitrol is one of the primary hormone help to utilize the calcium in the proper way. That is how our kidney will be help in the endocrine function also. Next, we move to the regulation of blood pressure. So in blood pressure mechanism, kidney secrete the renin hormone. Renin hormone is majorly it will be secreted by the juxtaglomerular cells of the kidney. This renin hormone will help to uh, constrict or dilate the vascular system of the body. This is how it can able to regulate the blood pressure of our body. So the mechanism, the whole process is called renin angiotensin aldosterone mechanism. So through this renin angiotensin aldosterone mechanism, kidney can able to regulate the blood pressure in our body. Next, we move on to the acid base balance. Acid base balance for the regulating the potential of hydrogen level in the bloodstream. The kidney play the major role to eliminate the bicarbonate, same way reabsorbs or secrete the hydrogen ion. This is how it can able to regulate the acid base status in our bloodstream. So I, for handling the hydrogen ion and bicarbonate, it can able to regulate the potential of hydrogen in the bloodstream. So kidney play the major role in the regulation of acid base balance in the following mechanism. Next, excretion of metabolic waste products. So obviously there are different kind of end product after the catabolism of after metabolism. There is a catabolism called excretory function. If we consume the protein product, obviously end product of nitrogen, urea, so these all are the thing will be eliminated through the kidney only. So kidney is one of the major excretory organ next to the skin. So there are some uh, substance will be eliminated through the uh, kidney channels. Next to regulation of water and electrolyte balance. Water metabolism is one of the major thing. In the water metabolism, if we going to see in detail means there are some minerals like the sodium, potassium, chloride, magnesium. So these all are the minerals will be good solvent in the water. So this water help to transport the different nutrient in our body. So that is how kidney help to regulate the water and electrolyte balance in our body. Okay. Next, we saw the overall function of the kidney. So, apart from the regular function, physiological function, one of the major function is the filtration mechanism. So, the filtration without complete the term called nephron. So, nephron is the functional unit of the kidney. So, nephron is the functional unit of the kidney. Uh, Without nephron, kidney filtration will not be done in the proper way. So, we're going to see a brief introduction about the nephron. Nephron is consists almost 1 to 1.3 millions of nephrons each kidney consists. So when the nephron number of the nephrons will be decreased, that time automatically the function of the kidney has been compromised. So if the healthy kidney should have the healthiest number of the nephron level. If it is decreased means automatically the kidney function will get deteriorate. So knowing the function of the nephron is much more important in the filtration aspect of the kidney or functioning aspect of the kidney. Next, we move into the details of the some structural and functional anatomy of the kidney. So basically, as we discussed about the filtration and all, basically the nephron, what are the functions will be carried by the nephrons means there are different spots. I'm not going to use that name for confusing you. Just the basically, I'm going to give the overall introduction about the filtration process. The kidney, we all know that kidney is one of the major eliminatory organ, excretory organ. So there are some minerals, there are some salts, there are some end metabolic wastes will be eliminated through our urine. So from where it will be eliminated? From the body. So from body where you can find material in the blood. So purification of the blood, from the purification is nothing but eliminating this harmful materials from the blood. So this is called filtration. So one of the major function carried out by kidney means filtration function. So filtration is done by this kidney. Then reabsorption means there are some minerals will be need for there are some minerals will need for optimal function of our body, like the sodium, potassium, chloride. This each minerals will help for the different metabolism of our body. So without this optimal level of that minerals, the body will not able to cope up in the proper way. That is how if the kidney possible to eliminate the major solvents through the urination, means suddenly the reabsorption process will be taken place. So based on the availability, we can able to reabsorb the certain minerals. Same way, based on the quantity, if suppose we need to eliminate the certain things, means that's also possible through the this mechanism. So basically, the nephrons have the two different part, medullary part and cortex part. These two part have the tubulary mechanism, the tubulary things. This tubulary organ will help to do the better work in the reabsorption. The same way the secretion, reabsorption is thing from the eliminatory tubules, we can able to reabsorb the needful solvents, mean that is a reabsorption. Secretion means from the bloodstream, we need to eliminate the certain solvents, certain minerals from the blood to tubules, means it's a secretion. So elimination, we know that eliminate through the excretory thing, like the urination, formation of urination. So these all are the major function of the kidney. In depth, it's carried by the nephrons. So the basic structure of the nephrons we saw, the Bowman capsule, glomerular capillaries. So this glomerular capillaries have the podocytes. These podocytes only help to play the major role in the filtration mechanism of the blood and the formation of urine. So next we saw the overall function of the nephron. Next we move on to the disease point. So majorly, the kidney, acute kidney injury, the chronic kidney disease. There are two major things. One of the acute condition. So we going to see in detail about the each type. First of all, I going to give the idea about the acute kidney injury. First of all, the acute kidney injury. Acute kidney injury, basically there is a three possibility of kidney damage. One is pre-renal. Pre-renal means the cause is not at all related with the organ. Organ means the kidney. So if in rare case, if any abnormality in the cardiac aspect, sudden cardiac failure, congestive cardiac failure, so ischemic heart disease, the kind of condition, heart cannot pump the enough blood, right? So there is a collapse in the circulatory system. So in that kind of condition, there is a acute kidney injury can possible to happen. So that is called the pre-renal acute kidney injury. Similar thing, similar way, because of the circulatory problem, there will be a lower in the cardiac output, low blood pressure, in accidental type, in road traffic accident. So these all are the condition. So hemorrhage, one of the possible thing. So there is a large quantity of blood can possible to uh, uh, blood can possible to eliminate from our body. So these all are the thing possible to induce the damage in the podocytes area of the kidney. So it's come under the type of pre-renal acute kidney injury. Next we move on to the intrarenal injury. Intrarenal injury, especially intrarenal injury is possible to affect through the any microorganism. Most possibly the tubular inflammation, most probably the glomerular inflammation. So it's possible to attack some viral and bacterial infection, cause the severe damage of the tubular organs. So because of the damage to the tubular organ, kidney will not able to function properly. Though, so this acute kidney injury come under the condition of intrarenal acute kidney injury type. Next we move on to the post-renal acute kidney injury. Post-renal means the function is got completely over. The filtration, secretion, absorption, excretion, everything will be got over. After the elimination of that urine, it possible to store the collecting system of the urinary tract. So collecting system, it I will be talking about the urinary bladder. So any abnormality in the passage of the urination, whether it will be ureter, whether it will be bladder, if any abnormality in the sense, any inflammation, any infection in the particular area, it may possible to affect the entire system in the sense the kidney area or function of the kidney can possible to compromise. So these all are the rare condition will be come to the post renal acute kidney injury. So I given a brief introduction about the acute kidney injury condition. It's very short in time. If you find the symptoms and all, it will be in the very limited period of time. Once you take the proper treatment, means you can able to overcome from the acute kidney injury condition. Majorly, the disease wise, it will be categorized uh, three different way. So once again, I going to refresh the pre-renal acute kidney injury, the same way intrarenal, the post-renal. Only this possible three types only uh, could damage the kidney. Next, chronic kidney disease. The chronic kidney disease, I will give the broad idea about the chronic kidney disease, how it will be going to possible to happen. So basically, in very subjective manner, I going to give the idea. So first of all, the kidney function has been compromised completely. So kidney function is compromised in the way there are some of the subjective signs you could feel, like dysuria, difficulty in urination, or oliguria, decreased quantity of urination. These all are the subjective signs you could feel in the beginning period of time. So this is how our the problem will be carried out in the chronic level, chronic stage. So basically, it start from the some subjective changes like decreased function of our kidney system. It will be affect the our elimination. Majorly, the urination will be affect. So this is how you can rule out some problem in our kidney organ. So most of the kidney will not give the all those symptoms in the very beginning stage. We are talking about the nephrons, right? So probably the kidney contain almost million to 1.3 million nephron for the healthy status. If it is compromised any circumstance, any rare circumstance, means the function of the filtration, the function of the kidney filter, everything will be going to affected. So in which way is going to affect it? So based on the function of nephron, it's going to affect. So whenever the numbers of the nephron going to fall below the 70 to 75 percentage, so automatically it will be affect the function of the kidney. So these all are the criteria to diagnose the chronic kidney disease. Next, progressive deterioration of the kidney. So in this stage, in most of the subjective signs will be occur, symptoms will be occur, not sign. Most of the subjective signs and symptoms will occur. So this is so we can able to understand some abnormalities going in our body. So next we move to the serious clinical symptoms, right? Elevation of some biochemical waste materials, is multisystemic symptoms like malaise, uh, dysuria, oliguria, uh, then extreme tiredness, anemia, so sudden weight loss. So edema, especially without edema, it is the golden sign for diagnosing the kidney abnormality. Is one of the major symptom is edema. So these all are possible symptoms we could find in the condition in the chronic stage. So the chronic stage of kidney disease is called end stage of renal disease. End stage of renal disease. Why it's called the end stage of renal disease? Uh, if any abnormality happen in the liver aspect, we know in anatomically liver can possible to regenerate or regrowth. Why not our kidney also do the same? Can you have an idea? So I will give the idea about the our doubt. So basically, kidney have only optimum level of nephron. With that optimum level of nephron, we can able to do the filtration function properly. Once the nephron level started to decrease, means our filtration compromised simultaneously. Whenever it will be reached least number of nephrons, so automatically our entire function get compromised completely. So this is how we can able to rule out the kidney disease, especially the chronic kidney disease. Whether we can able to regenerate the nephrons, which there is no possibility of regeneration of the nephron based on some diet, based on the diet restriction, based on the some supportive elements, we can able to retain some amount of nephrons to ability to function in the proper way. So we're going to see in later see in detail about our upcoming slides. So these all are the symptomatic aspect of the chronic kidney disease. Basically, first we going to talking about the sodium and water imbalance. So basically, as I said during the introduction time, kidney predominant role in the water and electrolyte metabolism. There are some minerals will be able to maintain that water metabolism, like the sodium and chloride and potassium. So if the sodium level uh, will be maintained in the such a way optimum level, it's supposed to maintain in the 132 to 138 milliliter per international unit. If it is excess in the body, means automatically the sodium has the potentiality to absorb the some water. So that is why we get the edema in our lower limbs. Why? Because it's a lower extremity is more in the uh, how can I say? So based on the pressure, it will be the eliminatory system will be affected. So so that the more amount of sodium can possible to obtain the water content. So automatically the edema could be happen. Similar way, if you talk about the potassium also play the major role. If the potassium will be excess in our body, it could possible to increase the heart rate, it increase the cardiac arrhythmia. Same way it is able to maintain in the optimum level. So during the time of chronic kidney disease, these two minerals, mainly the sodium potassium level will be not regulated in the proper way. Most possibly the sodium level and potassium level could be in higher. So we, our major task to go through and follow the during the biochemical analysis, if it is excess, we need to try to reduce the amount of sodium and potassium. The another way, if the same level will be resist in our body, it could affect the another system in our body, like some cardiac abnormality, some vascular abnormality like edema, cardiac abnormality like heart failure, the hypotension. So these all are the thing. Next, on to the elimination of nitrogenous waste. Mainly, the nitrogenous waste means end product of the protein metabolism. There could be a some harmful nitrogenous wastes like the urea, blood urea nitrogen, the creatinine. So these all are the thing will possible to eliminate through our kidney, whether our kidney function in the normal way. If suppose in the rare case like a chronic kidney disease, these all are the biochemical nitrogenous waste material will not possible to eliminate our kidney through our kidney channel. So it will be stagnated in our body itself. So it's alter our entire metabolism in our body. That is why we are getting the some systematic subjective signs like the malaise, the loss of appetite, nausea, vomiting. So these all are things based on the some dumping of abnormal waste material. So next, in introduction itself, I mentioned about the erythropoietic function. So mainly it's called erythropoiesis, production of the blood cells. So production of the blood cells, kidney have the predominant role in secreting erythropoietin. So without erythropoietin, the erythropoiesis will not be in the proper way. So it will be compromised in the erythropoiesis. So based on that, RBC level also be decreased. So it leads to the anemia. Next to the acid base balance, so absorption and excretion of the hydrogen and bicarbonate, if it will be regulated in such a way, there is no abnormality in the acid base balance mechanism, or otherwise it prone to acidosis or metabolic alkalosis. It will be seriously affect our the respiratory system also. So it prone to the respiratory acidosis or respiratory alkalosis. So gasping of breath, in how can I say, some physiological changes in the function of the lungs also may possible. Next, we move into the vitamin D metabolism. So mainly the calcitrol, one of the major hormone, will be secreted by our kidney. So without calcitrol, the vitamin D metabolism will not be fulfilled. So then only we can able to utilize the available base of the or active base of the vitamin D3 only will get by the activity of calcitrol. The same way, the phosphate mechanism also will be affected by this uh, uh, deficiency of calcitrol or deficient in function of the kidney. So these all are the possible symptoms in the different organs. So it multi-systemic damage, multi-systemic problem. Chronic kidney disease is not a single problem. It contributes the different metabolism in our body. So it may have the some systemic symptoms. So I explained about the different conditions, different organs, and different symptoms we have talking about, right? So that's all about it. Next, in conventional method of treatment. So in conventional method, what they do means, basically there are two method is possible. One thing is pharmacological intervention, another thing is mechanical intervention. So before going to decide whether which is suitable for the which kind of the people is much more important. So if you're talking about the kidney, first of all we need to assess the some uh, biochemical analysis like the kidney function test, the urine test. These all are the major thing we need to go through. So I'm not going to in depth about the biochemical and kidney analysis. Just I will give the some specific end product like a creatinine, blood urea, nitrogen, urea. So these three will play the major role. Whether the creatinine level will be excess in our bloodstream, suddenly the it will be affect in the systemic way. It will prone to the severe kidney damage. So that is why we need to eliminate that end product, metabolic end product, majorly the creatinine, blood urea, nitrogen, that urea. uh, so uh, so based on that, they will keep the criteria. What criteria means, if it is in the 6 gram per milliliter of blood means, 6 milligram per milliliter of blood means, they will suggest you to take the medications like diuretic pills, called urinary pills. So it will be induce the excessive elimination of the urine. Through urination we can eliminate the some amount of creatinine, blood urea, nitrogen, then urea. If it is more than 6 means the point level. If it is more than 6 means the person is needed for the dialysis. Dialysis is a mechanical intervention, is totally invasive method. There are some machinery invention is needed for the purification of the blood. So in mechanical intervention it will be divided into two way. One is hemodialysis, another one is peritoneal dialysis. So this all about the conventional treatment method. So not only based on the six that creatinine level, even some other criteria also there, like the glomerular filtration rate. Glomerular filtration rate is above 90 ml means our kidney function will be good. Whether it will be decreased below the 90 means some kidney abnormality there, or we can understood that our kidney function has get compromised. So based on that, they will find the classification. So based on the classification we can able to give the conventional treatment. Basically it started from the four, from 90 to 60, from 60 to 30, 30 to 15, then below 15. So these all are four major classification being classified by the World Health Organization. So based on that only we can plan the treatment schedule for the kidney patients. So if it is optimum level, like if it is maintained in the 90 or above 90 means it's okay, that we can able to go with that some of the medication like diuretic or nutritional replacement therapy. Why? Because diuretic can possible to eliminate the some of the minerals from the body, it's may needed for our body. So because of the diuretics, it will be eliminated in completely. If you take the diuretic, means there are different kind of diuretics, the loop. So this will be in going in depth. I'm going to give a very brief introduction about the each topic. So there is a need for the nutritional replacement therapy. So these two will be carried out, both combined to carried out in the pharmacological intervention. Same way, some of the people's the glomerular filtration level will be maintained below the 60. So per day, the filtration of uh, the glomerular filtration level will be below the 60, means suddenly the dialysis will be needed for the such a people. Not only based on this criteria, they're going to fix, even they're going to go through the some more the biochemical analysis like kidney function test, urine test. So even the hemoglobin level also we need to check simultaneously. So this will give the idea about which kind of the treatment will be necessary for the patient condition. So that's all about the conventional treatment method. Next, I'm going to give the brief introduction of the yogic management. In this yogic management, I am not using any kind of the method of treatments. Only I going to give the holistic yogic lifestyle. So whether the yogic lifestyle will able to adapt by the kidney patients, if they can able to adapt the yoga as their part of life, means how they can able to come across this kind of the kidney alignments. So we going to see in detail about the holistic lifestyle based yogic management. Okay, so here I'm not going to give any specific suggestion or prescription for the yoga. Just I going to carry you as a holistic method of treating the patient in the ancient time. So let's move on to the yogic management. Okay, according to yoga, vyadi, so we are talking about the kidney disease, right? So will in generally uh, disease is a vyadi. So according to yoga, vyadi is two types. Majorly it's divided into two types: anadija vyadi, adija vyadi. Adija, anadija vyadi. So first I going to explain about the anadija vyadi. Anadija vyadi, it's mostly anadija vyadi caused by some of the external factors. External factors means some environmental thing possible to give the contribution towards the abnormality in the body. Some of the physical factors possible to give the contribution toward the abnormality in our body. So it's all come under the physical related factor. So it's come under the anamaya kosa. So what is anamaya kosa and all I will tell you later. So anadija vyadi basically it caused by the some external factor we saw. Next, I'm going to explain about the adija vyadi. Adija vyadi means adija. In right now, in current scenario, we need to talk about the adija vyadi morely. Why? Because right now it's more predominantly we are troubling with non-communicable disease, right? Most of the non-communicable disease possible to happen because of the adija vyadis. Adija vyadis is mind related, mental related things. So most of the problems will be happening because of the mental abnormality. It's not a psychological problem. It's based on the some mental abnormalities. I going to give a brief introduction about the what are the things and all. So adija will be uh, possibly affected by the imbalance in the vitals. So in vitals means we're going to see what is a prana. In yoga, vital means prana. So what is a prana? So these things we're going to talk in clearly. Next, uh, another thing of adija vyadi is it possible to affect because of the it combined form of both anadija and adija. It's called psychosomatic. In modern medicine, if you can able to give the name of combination of both anadija adija means psychosomatic. Some of the psychological abnormality can possible to affect the somatic function of the body. So we're going to see in detail about the when the time comes. I'm going to give the some of the examples like abnormality in the HPA axis, hypothalamic pituitary adrenal axis. So next, Manomaya Kosa. So in this Adija Vyadi, we're going to deal about the Manomaya Kosa majorly. Why? Because most of the non-communicable diseases starting root cause is the mind. We need to take care about our mind properly. If not, it will give the some serious illness to our body. So in which way it possible to affect the body, we're going to see clearly. Next, mechanism of disease. According to yoga, is purely based on yogic concept. So let's follow. Please stay tuned. So basically, as I given an introduction about the Adija, it's purely based on the mind, right? So whenever we got an emotion means there are different kind of situation, whether we can provoke it by others, whether we can provoke it by our own self. The situation we react in the society, right? We react in the external environment, right? That is called emotion. So there are different kind of the circumstance we can able to feel happily. There are different kind of things we can able to show some anxious, show some emotion. So this all come under the thoughts. So thoughts we can call it as a emotion. So this emotion will be stagnated more in our mental level, means it's a starting point of our disease. So this strong emotion influence the function of the function of the normal mind. So it will influence the our mind in such a way. So in yoga, it's called chitta vriddhi. Chitta means mind, vriddhi means fluctuation. So emotion, the strong emotion can influence change in the mind. So in which way it's possible to change in the mind, we're going to see now. So there are different kind of thoughts, emotion will be immersed in our body, stagnated in our body. So it suddenly it collapse our mental energy. Suddenly it collapse the peaceful state of our mind. Basically, our mind will be in the peaceful state. With some of emotion, with some of thoughts only, we are confusing our mind. So these all are conflicts induce the stress in our body. Stress. So it prone to the distress. Next, this distress level collapse the prana. As I said, prana is vital energy. So, as like the manamaya, the pranamaya is going to get abnormal in this condition. So, prana is get collapsed. So, without prana, our body will not function properly. So, due to the stress, is automatically affect the pranic channel of our body. So, prana it's going to alter. So intense feeling, intense emotional thing induced some distress, some stress related thing. It's going to affect the pranic energy of the body. Pranic energy of the body. Prana is essential. That is why it's called a vital. So whenever the vital energy being decreased, automatically our body is prone to some disease. So uh, this is how the root cause will be taken place. So automatically some alteration, automatically some hyperfunction. So there will be irregularity, there will be a disharmony in the metabolic, in the physiological function, in the psychological function. So there are different kind of function being affected by this lower level of pranic energy. So the biological disturbance uh, simultaneously it will be contribute to the some electrochemical abnormality also. The electrochemical changes induce the complete collapse of our body, complete abnormality in the structural level, in the cellular level, in the molecular level. Especially we are talking about the molecular level. We cannot able to see in our eyes in visceral way. Suddenly it could alter the change. Suddenly it could increase or decreasing activity can collapse the harmony of the body. So disharmonious body automatically prone to get some disease. This is how it will be transformed into the some chronic level. So organic medical illness. So medical illness nothing but the chronic stage of disease. So this is how the disease will be taken place. So in this table we saw some abnormality in the mental level called manomaya kosa. So these all are the sheaths of the body, vital sheaths of the body. It's essential to the normal optimal function of our body. So here I going to mention the three different sheaths. first of all start with manomaya kosa, then physical level, annamaya kosa, next pranic level, pranamaya kosa. So these three will be involved in the major cause of the disease. Next we'll go and compare with the modern medicine. So basically the conflicts, emotion, thoughts will give the alteration to the normal function of the manamaya kosa, mental level. Same way, if you see in the right side modern medicine, some psychological disturbance, we can able to give the term of some psychological disturbance. So here in the left you see the pranamaya kosa, imbalance in the prana, imbalance in the vital energy. So vital means prana, so pranamaya kosa get altered according to yoga, it's called pranamaya kosa. So in see in the modern science, the functional disturbance, the some of the functional abnormality like lethargic, feeling uninterested, depression, stress. So these are the functional disturbance you may feel in the stage. Same way, the final stage, abnormality in the anamaya kosa. So there will be a structural abnormality. We saw in the introduction of the kidney disease, there will be a compromise in the percentage of the nephron. So why the nephrons level being decreased? There will be a damage to the nephrons and a damage to the podocytes of the nephrons. That is why the number of counts will be decreased. That is why the acute stage of kidney injury can be transferred into the chronic stage. So the functional disturbance, the alteration in the metabolism, alteration in the mechanism of the body, alteration in the various function of the body, various physiological function of the body can induce the cellular and the structural changes. It's prone to the complete disease of the body. So this is how we can correlate the our yoga mechanism along with the modern science. So as I said previously, there are 5 elements will need for normal optimal function of the body according to yoga, I'm saying. So basically start with the anamaya kosa, introduction about the koshas, energy sheath of the body, then we move into the management side. So basically there are 5 different sheaths. It will be needed in our body in the optimal level. During the time of disease it get compromised. That is why the people prone to get some chronic illness. So basically it start let me start with the anamaya kosa, physical body, physical energy. So the overall physical energy will be regulated by annamaya kosa. Annamaya means physical body. Next to the pranamaya kosa, layer of energy. So in prana, if you see in the different language, the prana will be remain same. So the breathe, the air we breathe, it's also called prana. So without breathe we cannot able to survival, right? So that's much importance we give to that breathe. That is why it's called as a prana. So the term prana, it's not a simple thing. So that is why it's come under the important category. Pranamaya kosa is much more important to optimal function of the body and functional aspect of the body. Next to the manamaya kosa. So most of the disease will be started from the starting point. The our emotion, thoughts, the conflicts, these all are kind of the catalyst. It stimulate the manamaya kosa, induce abnormality, induce some changes in the manamaya kosa. That is how our disease will be get transferred. So in right now, in modern period of time, we prone to get the non-communicable disease because of we are not able to control the or regulate the manamaya kosa in proper way. That is why we are getting the non-communicable disease. We can able to know the technique to regulate the manamaya kosa, means we can be healthy and live healthy. Next to the vinyanamaya kosa, layer of intellect, layer of the knowledge. So these all are the higher mental stage. So apart from conscious, it will be give the energy to our body, mental energy. This also transformed form of the mental energy. Next, anandamaya kosa is blissful state. Blissful state means enlightenment stage, enlightenment. So in day-to-day lifestyle, if you can able to categorize the how many attempts can prone to get anxious, how many attempt can how many episodes you can get come across the happiness moments, mean you will keep the anxious will be in the higher episodes, higher frequency. So nowadays we are not able to have the choices of in the blissful state or the happiness state. Most of the time we are encounter in the anxious or some of the worries. So this kind of the negative thoughts only will be higher in our day-to-day activities. That is why our entire manamaya will be get the function of the manamaya get compromised. So there is a point our non-communicable disease will be started. So this all brief, that's all about the brief introduction of the different sheets of our body. Next we move into the method of treating the disease. So especially in the kidney disease, I give the holistic approach of the uh, handling the kidney disease. So basically yoga based lifestyle can able to ensure the health, same way it can able to give the optimized level of function in our metabolism. So these all are the major things we are discussing right now. So if we can able to regulate the anamaya kosa means, first of all we need to practice the asanas, different practices, post related activities. There are different asanas in this presentation. I have not mentioned the specific kind of asanas, since I have talking about the holistic approach means I need to cover all those things which is possible to act the kidney function in the proper way. So I am not able to leave anything. That is why I have mentioned all those things in general way. I have not mentioned anything in specific way in point of view. So basically the asanas, if you are practicing the asana, if you can able to incorporate the asana as your lifestyle means, you can able to get the physical energy through the function of anamaya kosa. Next to the pranamaya kosa. Basically in yoga it's called kriya, means cleansing techniques. So there are six cleansing techniques. Satkarma it's called in yoga. According to yoga it's called satkarma or satkriya. There are six different techniques to cleanse our body, eliminate the phlegm in body, eliminate the kaba in our body, eliminate the waste material in our body. So that is why we can able to rejuvenate our body. We can able to introduce the good environment in our internal state of our body. So once you cleanse the body, then automatically there will be a place for good energy. So automatically if you do the pranayama, the vital energy, the prana will be restored in the body. So this is how we can able to regulate the pranamaya kosa. Next come to the manamaya kosa. So manamaya, the mind means we in previous practices we can give the some kind of physical related or breath related practices. In manamaya means the is overall talking about the concentration, mind oriented task. So basically it's mind oriented task. So we are the masters to control over our own mind. It's not by someone or somebody can able to control your own mind. So your thought, your emotions only negative side also. So, so most of us will be traveling in the negative side. Just your path come to the positive side. So these all are the methods will get back to you in the past. This is how we can able to control the manamaya kosa. So let me start from the dharana. Dhara means concentration. If you can able to concentrate on single point of mind, you can able to control over your mind. You can able to be without thoughts, without emotion, means that is the stage you can be in the presence. Most of us you see, whether we are worried about our the past thing or we are do plan about our the future things, not be in the even in our program also many of you correlating with these points with your past encounter, right? Past experience, right? So be in the presence. Dharana will help you bring to uh, uh, sustainable function in the present situation. Next, santosa, contentment. What you have, be with, have with what you have. So that is a contentment of santosa. uh, First of all we should thank to our environment, we should thank to our parents, we should thank to our subordinates, we should thank to everyone, because we have our healthy lifestyle, right? With your own property you be able to creates happiness with that product. If it is not, there is a point your problem will be started. So santosha is one of the major limb in yoga. So if you adopt this all are the your principle in your life, you can able to come across the abnormality of the body. Next, Iswara Pranidhani means surrender to the God. It's talking about the some really spiritual oriented way. It means surrender. You should believe about the some energy, some superior energy will be exist above us. So we need to surrender ourselves with true heart. So this also one of the thing can able to put your attention to the single point of mind. This is how also can you able to regulate your manamaya. There are some satsangas, bhajans. So uh, even the visiting the temple, so this also come under the manamaya kosa. If you see, uh, we don't even practice the evidence based thing. Even whenever we saw some of the down streaming situation, some of the emotional triads, we used to visit the temples, we used to visit the some natural oriented places automatically without knowing these things. Why? Because we could have some energy while visiting the places. We can able to control the mind, or we can able to uh, put our mind to single point of concentration. So this will be happening. It's not the magic. No magic will be work upon that satsang or bhajans. It's simply you can able to forget the thought, forget your past emotional triads for a particular period of time. Automatically your mind can able to attain the peaceful state. There is no miracle will be worked in the satsang or bhajan or visiting the temple, doing some pujas. Automatically during the time of the bhajan or satsang. So whenever you will be in the present, you can find out the technique to be in the present. Automatically you can able to reduce the stress and depression level in your body. So automatically your manamaya kosa will be regulated. That is why I have mentioned these points. So without knowing these all other things, even our people are even the layman following these other things. When they are feel stress, when they are feel depression, when they are feeling not well, those are the particular period of time they will use to visit the different temples and all. Next, Vinyanamaya Kosa. Vinyanamaya Kosa, it's kind of the higher conscious stage or intellectual stage. So, where it is our creativity comes from. So, right now, if you ask anybody, most of us will not able to react spontaneously. Why? Because we are not be in the present. Even we are not even plan for the future also. Why? Because we are immersed with some preoccupied mind. So whenever we will come across, whenever we leave from the preoccupied mind, then only we can able to use the mind from creating some of the useful idea for the our own growth. So yeah, meditation, the swadhyaya, introspection of our own, introspective ideas of our own. So this will be help you to regulate your Vijnanamaya kosa. Dhyana, especially I need to talk about the meditation. Meditation is not something which you can able to travel with your situation or surrounding thing. It will be a travel to your own. You need to travel your own. You need to explore your own self. That is a dhyana. You need to explore your own self. That is a dhyana. It's not some which is not something somebody will give the idea, or we need to imagine, or someone we need to dream on someone, or we not physically closing our eyes and focusing on something. It's kind of the path, it's kind of the travel, it's kind of the journey traveling to your own. So if you do so, you can able to regulate your Vinyanamaya kosa. Next to the Anandamaya. Most of us not familiar with this Anandamaya kosa, because in our day-to-day lifestyle we are encountered the so many horrible things like stress and depression. If you ask anybody, even the school kids also, if you ask them, they will say spontaneously that we are in the stress, that we are in the depression, that we are in the most of the kids, if you observe, the tolerance capacity has been compromised with their task. They have the less tolerance. Why it will be happen? Because during the time of children or adolescent role, we should be more prone to get some enlightenment stage. If you see, if you dream in your mind, if you are playing in the ground, during the time of playing, whether you can able to visualize the surrounding things, or whether you can able to notice the what is will be going around in and around you, it is, there is no possible at all. You will be focusing on that particular game only. During that game, can you able to see in your face that your face will be brightened, your mouth will be laugh, your face the expression will be created by your face will be in the positive mode, positive side. So that is called the enlightenment, the blissful state. So the same way, in yoga, there is one of the wonderful technique called yoga nitra. So there you can able to reassure the your enlightenment stage by the help of yoga nitra. Can you to reduce the stress, depression, uh, there are some psychological abnormality also will be treated by the yoga nitra technique. Wonderful technique to bring to the some miraculous places in your mind. You can able to explore the different parts of your mind with your own imagination. So this is how we can able to control the anandamaya kosa. So as I said, during the time of mechanism, so these three things, this five altogether, this five will be contribute to the disease. Same way, if you can able to regulate this five means, you can reassure the, you can revert back to the abnormality of the any disease kind, any point of time you can able to regulate or revert back the some abnormality through this following practices. So once we adopt this following practices, automatically there is a harmony, there is will be a harmonious, there will be a balance, there will be a regulation in the different aspects like physical aspect, physiological aspect, psychological aspect, in the spiritual side also. So this all about my concept of holistic lifestyle based uh, uh, holistic lifestyle based concept for the kidney disease. So that's all about it, the yogic management. So let me give the some basic idea about the nutritional management. Why? Because nutritional management is essential. If we talking about the kidney disease means, without touching this point we cannot able to conclude the management side of the kidney disease. Basically, for the kidney disease, those who are come under the chronic kidney stages, we would suggest the sattvic diet. The sattvic diet does not contain any spices, it does not contain any salty, that does not contain any preserved materials. So it's a wholesome pure form of the food. In that wholesome pure form of the food also, there are some restriction will be there. We can able to use the vegetables will be prescribed by the sattvic diet. So mostly it will be creepers variety of vegetable. Most of the I can able to give the some example of the creepers variety of vegetables like rich gourd, bottle gourd, ash gourd. So these all are the creeper variety of important vegetables will be mentioned in our sattvic diet also. So this diet will be give the wonderful effect when you adopt this food as your regular basis of diet. It can help to bring out the that excessive salt in your body. Same way it can help, it will be play the role like a diuretic agent. Most of the even the plantain pith also mentioned in the sattvic diet. Plantain, even the brinjal also have mentioned in the sattvic diet. So these all are the wonderful thing in our ancient time itself it have mentioned. So if you adopt the these all are the variety of vegetable in your day-to-day lifestyle means, automatically it will be work as a diuretic agent. It will be eliminate the more salt in your body. It can regulate the function of the kidney. Same way it will not harm to the kidney. That is a main important point. It will not be the harm to your body. So there is a term called azotemia. The azotemia is condition is uh, uh, there is a more amount of nitrogenous waste product, more amount of biochemical waste material. When it will be more level in your bloodstream means, automatically your body metabolic get confused. In that time only we need to adopt the this kind of the nutritional replacement therapies and all are the such a main diet plan for the kidney disease. So kidney disease one which something the peoples would follow the specific diet plan. Without specific diet plan, the kidney management will not be fulfilled. So that fluid imbalance, so if they are edematous, if they are dysuric, if they are oliguric, based on the urine output level, we can able to give the amount of water. It's not something we can able to advise the 3 or 4 liter of water. So advising the water, advising the fluid level, we should be more conscious. So based on the symptoms of the patients, based on the assessment, uh, we are giving the holistic approach, but we are not practicing the pseudoscience. We are practicing the evidence based medicine. So evidence based means we can able to go through the some biochemical changes. So based on the follow of the chemical analysis, we can able to prescribe the some amount of food materials, some amount of nutrients based on the need we can possible to give. Out of one, the water is which important thing. Why? Because there is a problem in the elimination of water in base of urine. So there is no point that you can give the increased quantity of water for the kidney patient, which is harmfully you are killing the patient. So for the liquid based diet means there will be a restriction based on the urine output we can able to give. Next, the sodium, the minerals. If you talk in the minerals, mostly the form of minerals will be in form of nutrient in the product which we consume. So there will be a restriction in the sodium and potassium level. Why? Because there will be a problem in the elimination. So if you find that there is a more level of sodium which present in our bloodstream, there is a possibility of water will be reabsorbed by the sodium. So possibly it could be affect the vascular channel by the edema. So it general edema, local edema in the palpebral area also we can find the edema. Anasarca, it's kind of generalized edema. So if you avoid the some less sodium diet means it could help to function betterly. The same way, the potassium and sodium level has to be give the moderator or restricted level. Next, the protein diet. Non-protein calorie supplement will be advised. It's not something that we can cut down the entire protein. It's majorly we are since we are following Sattvic diet. There is no non-vegetarian will be advised in this diet. So we can able to give the some plant-based proteins with the optimum level based on there. As I said previously, always keep in your mind. So we can give the n number of diet, but our patient will not be same from one to another. So there are different remedies available for curing the kidney disease, controlling the kidney diseases or symptoms, but based on the patient condition only we can able to manage based on the different varieties. So out of one, the protein restriction will be important thing. So based on the protein level in the body, we can able to give the can able to plan the diet for the specific condition or patients. So that's all about the nutritional management. So basically I have mentioned the diuretic vegetables, diuretic property available in the some of the vegetable. So those vegetables we can possible to give. So mostly if you know the Sattvic diet clearly, you can come up with the idea. Because in Sattvic diet mostly they will use the plant based and cereals diet. So in kidney disease also we can use the cereals majorly. So for energy giving diet will be play the major role comparatively with the bodybuilding diet. So we can give the some cereals, mashed well cooked foods. Then about the fluid, it will be restricted level. Why? Because it prone to get some edematous, prone to get some alteration in the circular function. So then minerals wise, the sodium, potassium will be restricted on level. These all are the very major thing I have mentioned. Apart from this, there are much more thing will be there in therefore talking about. So that's all about the nutritional management. So I have touched the yogic management and nutritional management. And so this is how we can able to control the symptoms of the kidney disease, whether it will be acute or whether it be a chronic stage. Even there is a no matter, no point there is to be present to adapt the yoga as a lifestyle for the kidney disease, so they can able to easily follow these all are the things to get improvement in their condition. So that's all about it. If you had a doubt, you can ask me.
Thank you, sir. It was a wonderful session, sir. Especially the details you have given on the Panchakosha theory was really amazing, sir. Thank you for this wonderful session, sir. Audience can post their doubts
Thank you.
in
Thank
the
you, doctor.
comment. So could you please suggest any asanas that can be practiced by common people for
Yeah, yeah,
preventing such disease?
yeah. I can able to suggest the mostly the asanas and pranayamas basically based on the patient condition only we can give the some of the asanas. If they are in severe chronic stage of conditions like the malaise or weakness, especially in if they anemic means we need to avoid such kind of practices. We can able to give the pranayama. Why? Because we need to able to restore the prana, right? So once we can able to restore the prana, we can able to give the some of the asanas. Asanas like Mandukasana, Vajrasana, Sasangasana, Pavanamuktasana, Pachimotasana. So these all are the asanas can to restore the energy of the kidney. So this we can able to practice. Mainly, I would suggest the pranayama. Why? Because if you see the end stage of kidney disease, most of the patient they cannot able to do their normal task. They cannot able to even walk from their bed. So in that kind of condition cannot able to advise the yoga asanas and all. But pranayama one, those can able to practice easily by their own place itself. There is no specific rules and regulation for practicing pranayama. So they can have the pranayamas by their condition itself. So pranayama I would suggest. Then meditation is wonderful thing. Then some of the relaxative techniques like deep relaxation technique, quick relaxation technique. Then the one of the amazing thing is yoga nitra. It's completely restore their vital energy, completely regulate the all koshas, irrespective of the type. It can able to control the or regulate the all koshas. Yoga nitra I would suggest.
Okay, sir. Thank you, sir. Thank you for the wonderful session, sir. Hope
Thank
there
you,
is
doctor.
no,
Thank you.
since it's in a clear session, audience don't have any doubts, sir. So here we come to the end of the session. என்னன்றி கொன்றார்க்கும் மொய்வுண்டா மொய்வில்லை செய்நன்றி கொன்றமவர்க்கு. One may slain every goodness and yet escape, but no escape for one who slain gratitude. So with all gratitude, I thank our sir for spending his invaluable time in sharing his wonderful knowledge with us in midst of his busy schedule. Thank you, sir. Thank you, everyone, for maintaining dignity throughout the session. Last but not the least, I thank the whole organizing committee of IAS College, without whom this event would have been impossible. Thank you, everyone. Stay connected with us in the social medias for the future updates about the future sessions. Thank you, everyone. Until we meet for the next time, thank you. Stay blessed, stay healthy. Thank you. Thank you, sir.